Hi, I'm Dr. V. I'm Chief of the Spine Pain Program at Bloor Pain Specialists, and today I'm going to be talking about MRI. Facet hypertrophy means that the facet joint, which is a joint between two vertebrae, and we have many vertebrae. Now, we have 31 levels. Most of them are separate bones. We don't have one spine bone, one tube. We have separate bones, and they have to click into each other. By the tailbone, they're fused, so they're actually, they're not moving. There is no joint, but everything else has to have a joint. That's how we rotate. That's how we move. That's how we turn. That's how we bend. That's how we flex, extend, and so on. Our joints, and we have one on the left and one on the right between every pair of vertebrae. And those pairs can get arthritis in those joints. As we think about a joint being inflamed, that's where the term arthritis comes in. Arthrosis is the growth of a joint. Sometimes we'll talk about that in the context of symptoms of the physical exam. Hypertrophy is a more of a direct measure from an MRI. It is a hyper means more or a lot of, and trophy is growth, meaning that the joint has grown bigger than it would be expected to be. Now, granted, there is variability from person to person. We all know that there are people of different heights and different sizes, but there are typical sizes of specific structures in our body, and so these things can be measured. When a radiologist reads an MRI, they can read that portion of an MRI that looks at the joint and says, hey, this one is larger than it should be, and they can measure that compared to the neighbors above or below or to the left or right. They can state that on the left side, there's hypertrophy on one particular level, but not on the right. They can similarly say it's for the upper vertebrae or the lower vertebrae. When we're talking about upper and lower, clinically, typically it's the lower ones that are going to get it first. Why? Well, two reasons. Some of the upper ones, the angle of the joint is more up and down. It's more for flexibility, so people can just bend. It's not really that weight bearing. Versus some of the lower joints are more side to side, so that the joints catch. They're not so much for flexibility as much as they are for weight bearing. And we have one top, but we have two legs. So something's got to catch that weight and split it, and that tends to happen around our midsection because that's where our legs start. And that weight distribution is cushioned by a few of those bottom joints before it is transitioned into the leg. And so those lower segments are the ones that bear the brunt of the forces of gravity and grow first, in most cases. Well, it's an excellent question, but it doesn't always need treatment. In some cases, the joints are completely asymptomatic. In fact, when we see that joint on the MRI, we have to ask ourselves, does it matter clinically? Does it matter to the patient? We'll do a physical exam. We can push on the joint just as you can push on a scraped palm. And you'll say, hey, that hurts. Don't touch there. Well, when you push on a joint and maneuver the patient to close that joint as we push into it, the patient will say, oh, that hurts. Don't do that. Well, that identifies that, yes, that facet hypertrophy is symptomatic. But in other cases, we push on a joint, the patient says, nope, I don't feel anything. That's not it. And we believe them because they're the only people, everyone can only feel their own symptoms. We're our own sensor for pain. And so when a patient identifies that, no, this is not the source of my pain, we don't do anything about it because it's not symptomatic. And the MRI finding alone is an identification of what they look like. It doesn't say anything about their function. It doesn't say this is strong, this is weak, this is itchy, this is painful. It's just a picture. It is information that we can use clinically to identify what's bothering the patient. Now, there are other structures around the joint. There are muscles, there's a disc that's cushioning the two vertebrae, there's a ligament beside the joint, there's the nerves that are passing through. There are a slew of other structures that could be causing symptoms, but on its own, we don't treat just the imaging, just the MRI results. We have to see that this matters to a patient. In some cases, people do need surgery. The joint can grow and grow and grow. As it grows in a 3D way. And we've all seen people who have arthritis of their fingers, and those fingers are no longer straight. As the joint grows, the finger starts to change angles. So sometimes with the joints of the spine, as they grow and grow and grow, the vertebrae slide along each other. They're no longer aligned in a nice tube for the spine to dangle down. And in fact, as they grow larger and larger, those vertebrae, the rings of bone, slide along each other and form more or less the Olympic sign, where there's less space in the center for nerves to pass through. This can be dangerous for the nerves, for the spinal cord, and some people can cause spinal cord injury or even paralysis. And in those cases, sometimes it's an emergency to have surgery. But facet growth is not a process that happens overnight. It takes years. So those emergencies tend to happen in the background of not having much space to begin with, and then having an injury, a slip and fall, a sudden acceleration, deceleration event, being fatigued and not moving in a normal way. The growth on its own, it puts people at risk, and over time can compromise some of those nerves and their function by pinching them slowly, slowly, slowly. In those cases, that's where surgery is done. Sometimes the arthritic nature of those joints is treated with surgery, but that is typically a last resort. Sometimes those joints are fused, sometimes the edges of them are shaved, so a large joint can shave down the edges to create more space by making the joint smaller, although this sometimes causes some instability, and the joint is fused to prevent mobility and instability in some cases. Alternatively, those joints can also be injected with cortisone. They can be treated with exercise. They can be treated with radiofrequency ablation, treating the nerve branches that plug into those joints so that people don't feel their arthritis. They can be treated with acupuncture, chiro, osteo, physio, a slew of home exercise programs, yoga, a lot of options to treat these joints that are non-surgical. And so surgery is not a typical first line for facet hypertrophy. So facet hypertrophy really means growth of a facet joint. And we have 2 facet joints per level. We have one here and one here. Notice inside the joint, we have rough, wavy edges. Those rough edges aren't the same. This side looks like it's a little more rough than this side for the most part, versus over here, it's a little bit blurry. So maybe the inner edge of this facet joint is a little more arthritic, but here on this facet joint, we have something extra, a facet joint synovial cyst. And that is an outpouching of the joint fluid. That can be a sign of degenerative facet disease. It's something that can pinch on the neighboring nerve, as it's doing in this picture. This is the dorsal root ganglion, the little grayish structure here, and a normal one over here with lots of space. In this side, the cyst is pushing on it. A large joint could also close this space and narrow the amount of room that that a nerve has to pass in between disc and joint. Other joints, if we scroll, are not as big. The inner edges are smooth. The joint itself is smaller. And scrolling again, some of the joints are smaller. Again, smooth inner edges. It really can show how on an MRI we can identify the architecture of an arthritic joint, and then clinically we can correlate that to see if somebody has symptoms. Thanks for watching today's video. Please like and subscribe below. If you have any questions that you'd like us to address in a future video, please leave them in the comments area. If you want us to answer any questions about your care specifically, please contact the clinic directly.